Thank you so much for joining us on this episode of Family Matters. My name is Purity Museo. It's been 7 months or so since the first case of coronavirus was reported in Wuhan, city of China, and on the 13th of March, the country recorded its first case of coronavirus, and still numbers increasing. Today, we hit the 10,000 mark after 379 people tested positive. And as we speak, Kenya has 10,105 cases of coronavirus. Have we been doing it the right way, the response, preparations, and also handling COVID patients? That is the discussion we'll be having tonight with the World Health Organization country representative, Dr.Rudi, who is here with us in studio. Thank you so much once again for joining us on the Family Matters show, and welcome.
Thank you so much.
Yes, the last time I had a conversation with you, Doc, if you can remember, Kenya had not reported any case of coronavirus, so we were talking about other African countries. But today, as we sit here, over 10,000 cases now have been reported in the country. Most people were talking about going on with their businesses after coronavirus, but it's taken at least 7 months for the world, and there are questions whether this will really end.
It will end sooner or later, but it's going to be still a very long period. So in Kenya, certainly, we're still very much at the beginning of the outbreak. So you notice that slowly the cases are increasing day by day. We're seeing record numbers of cases being reported. So in Kenya, we're not near the peak. It's going to be very much longer before we actually reach that peak. And that's true for most of Africa. Many countries of Africa have not even seen the rapid rise that we've seen in the Americas or in Europe. So I think we're still in for a very long period.
All right. And when you talk, because it's a shock that you're saying we are as a country still at the beginning of this, and it's 4 months on, and most people are really already tired and saying, when will this come to an end? And you're saying we're yet to get to the peak. Is there a duration or a period of time that that WHO estimates that we expect most African countries to have reached their peak? And when you talk about a very long time, is it the whole of this year? When do we expect this peak for most African countries? Because most of us, we are at 4 months or so. So when will this peak, and when do we expect now the cases to start dropping?
It's not quite clear. I mean, there's been a lot of modeling being done, and it really depends on several factors. It depends on how much the people follow the guidelines that the government is giving, both in terms of washing of hands, but then social distancing, the wearing of a mask, and all those things, all the rules and the travel restrictions, all those things that have been put in place, those determine how quickly the disease actually spreads. In Kenya, the models say different things. Some models say that by beginning of September or October, maybe November, but it really is very much dependent on how people act. That really will determine how quickly this is over. I think we should expect that this year, certainly, cases will still be there for the entire period.
And when you talk about a peak, maybe from your data, do we have countries around the world that have reached their peak?
There are several countries that have passed their peak. So among them, some of the European countries, and of course China, where it all started. So all of those countries have actually had a maximum number of cases and now are recording many more cases. At the same time, we should know that some of the countries that have had their first peak have gone down, are now showing a second peak, are coming back with increased numbers of cases. Countries like Israel or Iran, or indeed the US, where the cases have actually flattened out for a period and then go up again. So it's not over. I think we should really expect this to go much longer.
All right. And when you talk about the peak, Doc, does it mean that we must see surge of cases, then that's what peak would mean? Or should we assume that most African countries, let's say, are following the guidelines and therefore they have reached their peak? Or what exactly defines a country that has reached their peak and now the curve is slowing down?
So the peak would actually be shown at the time when the number of cases decrease consistently after 2 to 3 weeks. Currently in Kenya, almost every day we are reaching a record level. And unfortunately in Africa, I think there's no country yet that has reached its peak. If you look at South Africa, they also day by day recording record number of new cases. So I think throughout the continent, we are still very much before the peak. We are still going to have many, many more cases in Africa.
And from where you see it, is this the worst pandemic?
It's the worst pandemic in our lifetime, the worst that we have experienced. Of course, in 1918, there was the big flu epidemic, but that was more than 100 years ago. So I think for us, certainly, you and me, it is going to be the biggest outbreak that we've experienced. Unfortunately, it's so that it's possible that these kind of outbreaks will happen more frequently. There's more interaction between wild animals and people, and that is one of the sources of the virus. And of course, the international travel, the people moving around with aircraft, mean that these kind of diseases can spread much quicker.
All right, and let me ask you, do countries, especially because there were concerns that African countries do not have the capacity to test and even to treat, that's why most countries or European countries were arguing that African countries are not experiencing more number of coronavirus cases because they're not testing much. Is that the case?
It is true that in Africa there are not that many tests done, so we've had a shortage of tests throughout the continent. And really South Africa is the country that is furthest advanced in testing. So the restrictions of the number of tests done are truly a big issue to actually show that the cases are there. But as you mentioned earlier, more than 7,000 tests were done in the last 24 hours in Kenya. So here also the number of tests are actually increasing dramatically. But it's by far not enough. We have to test many, many more to really get on top of this disease. So this is a process that the government and ourselves actually going through to make sure that we get the right test kits and get the laboratories to do the tests.
Doc, let's talk about the importance of testing. Is there a relationship? Will the numbers that the countries begin or continue to test determine when they will get to the peak? Because sometimes we test, like today was the highest samples that Kenya has conducted, 7,000. Sometimes we see 2,000 samples being tested. Does this affect when we get to our peak and how we respond to the virus?
So the disease is not waiting for the tests to happen. Of course, the spread of the disease will continue irrespective if you're testing or not. So as we are here, day by day, many more cases are being infected, irrespective if you test or not. However, for us to know if there's a positive case, we cannot say until we've done the test. So the test is actually critical to actually determine where the disease is highest. For a time, we had in Kenya the highest number per population in Mombasa, but now increasingly we find the highest number per population coming to Nairobi. So we're seeing a very rapid increase actually in Nairobi at the moment.
And do the number of coronavirus cases in Africa, are they more than the ones being reported? Of course, considering we don't have the capacity to test as other European countries.
I think we can assume so. I think we know that there are many more cases that have been affected than what have tested positive. And that's so throughout the continent. All of the countries, many of the countries in the continent have had the same difficulty in getting the lab tests. So I think we can assume there are many, many more cases. We also know that there are many more asymptomatic cases, people that don't have symptoms and are positive nevertheless. So I think we can assume that there are many more cases than what has been tested. And that's not true only for Africa, it's across the world. Even countries like the UK and the US have had some limitations in their testing.
And when coronavirus was first reported in China and then it was spreading to other countries, especially from March, it did not take so much time before the symptomatic aspect of coronavirus was seen, because we saw a lot of hospitalization, more deaths being reported, especially in European countries. But Africa, most countries are at their 5th and 4th months, but we are still experiencing the asymptomatic coronavirus symptoms. You can explain why African countries are still on the asymptomatic aspect of dealing with asymptomatic symptoms of coronavirus as compared to the European countries?
I think there are two factors here. Firstly, Even in Europe, there were many asymptomatic cases. Ultimately, we found that out the more we got to know about the disease. So the fact that there are many asymptomatic cases has become a feature of this disease. Mm-hmm. The other thing, of course, what is being counted in Africa as an asymptomatic case is a case that at the point where the diagnosis is made, when the lab test is made, is asymptomatic. But in fact, many of these cases, after they test positive in the next couple of days, become symptomatic. So it actually, you're not comparing the same thing. In Africa and in Europe, the time frame has been a little bit different. But we know that there are many cases that are positive and asymptomatic.
Mm-hmm. And the coronavirus that we talked about in December, January, is it the same virus that we are talking about, or are we, from research, is there a mutation of this virus?
There are always slight mutations of the virus. It's of the nature of the virus that they do mutate. But it's not as rapid as the flu virus or anything like that. So the virus that we have currently across the world is actually quite similar to the original one that we had in China. There are small, tiny differences, but there's no big change that we find, for instance, in the flu virus that constantly is changing.
Let's talk about your WHO, your take on the response, the global response on this virus, from your advice on especially the preventive measures. Let's first talk about them. You had first indicated that people need to wash their hands, put on your face mask, and stay at home where necessary. Are they still applicable?
Absolutely. So those requirements are very much at the core of keeping yourself safe. So the personal behavior of each individual is really the key to this whole thing. So how people actually act in terms of washing of hands, of keeping their face covered, of distancing from each other, not going to big gatherings, that is really the key of the whole thing. That is the way that you actually contain this disease. Mm-hmm. And we've seen it work very well. So in countries that have had very huge outbreaks, such as Italy or Spain, it was really the lockdown, the extra restriction of movement, and these other interventions that made the disease come down. Mm-hmm. So we're absolutely convinced that the lockdown and the other measures have had a huge effect on actually preventing the spread of the disease. Mm-hmm. That being said, of course, people get complacent. After 4 months in Kenya, people getting restless. Mm-hmm. They feel that now we've been here 4 months already. They don't want to be kept constrained anymore. But unfortunately, Kenya is still in the rising part of the epidemic. So even now, it is of utmost importance that people maintain these requirements of social distancing, of not moving when they don't have to.
Mm-hmm. And what's your take on the global response against this virus? Are we in the right direction?
Yeah, it has been slower than expected. At the same time, I must say, the fact that we had the outbreak initially in China, and WHO declared this disease a public health emergency already on the 30th of January. This has given many countries a little bit of a head start. So even here in Kenya, there's been a head start that for 2 or 3 months, people knew that this was coming and they could prepare for it. And that really is helpful. If countries really used that time to prepare properly, they actually could have made a big difference. Mm-hmm. Some countries unfortunately squandered that opportunity and they didn't use it to prepare, and that's unfortunate because it means that people die and people get sick for something that could have been prevented. Mm-hmm. Fortunately in Kenya, I think some of the time was used very well to prepare the laboratories, to prepare the hospitals, and get ready for this disease.
Mm-hmm. And let's stay with the preparedness, Africa. You mentioned that there was a challenge, especially with testing. What's your also response on Africa's preparedness and how the countries are responding to this coronavirus? Would you say we are prepared 4 months or 5 months on?
I think we are better prepared than we were at the beginning, but we're not sufficiently prepared. So even now, as we are here in Kenya, but also across the continent, we see already that the hospitals are overwhelmed, that there are not sufficient personal protective equipment, PPEs, that lab kits are insufficient, etc. So the preparation has actually helped us, but there's still a lot to do. There's so much more to do. Here in Kenya, especially in the rural areas, in the counties outside Nairobi and Mombasa, this preparedness still has to gear up quite a lot for us to be sufficiently prepared.
And a point of clarification, African countries are still not experiencing a surge of coronavirus cases. Just again clarify, is it because they are adhering to the containment measures and the protocols laid by both the WHO and Ministry of Health officers, or again, is it does it have anything to do with lack of testing capacity and knowing who exactly is sick?
I think it's both. I mean, on the one hand, Africa got infected somewhat later than some of the other countries. So we are 2, 3, 4 weeks behind other countries. But as we can see from South Africa, in fact, the disease does occur and does occur in very high numbers in Africa. So I don't think we should consider ourselves to be immune to this disease or not susceptible to this disease. It will come to Africa as it's come to across the world. In terms of the question, is it just because we're not testing enough? It is true, we are not testing enough. But I think as we test more, we notice that actually this disease is much more widespread than we thought it was, as can be seen again by South Africa, where the testing has increased a lot.
And again, so much deaths being reported in other countries as compared to Africa, and Africa still asymptomatic. Most patients, actually in Kenya, the Ministry of Health released data that 78% of patients are asymptomatic. Yeah. Is there anything unique with Africans, or is it still mutating, or does it have anything to do with we got the virus behind other countries?
So in terms of the deaths, it's not quite clear yet. It seems that younger populations, like the African populations, there are many more young people in a country such as Kenya than in a country such as Italy, for instance. So one would expect actually this disease that affects and kills really older people much more than younger people to have less of an effect here. So I think that's part of the reason. I would be surprised if there was something really different about the African population in terms of the susceptibility. I think Africans and South Americans and Europeans and Chinese, everybody's equally susceptible. This virus has not been around at all before. So I think everybody's equally susceptible, but I think that we will be in the same way affected as the rest of the world, even though we might have lesser deaths because we've got a younger population.
And most Kenyans feel that Kenya is not doing enough to protect its citizens. Maybe you can rate Kenya or try to compare us with the East African community or even other African countries. How are we doing? How are we responding to this deadly virus?
I think actually Kenya did quite well. They actually stopped gatherings and actually started the restrictions of movement very much after the first case already. So if you look at countries like the UK, they actually started many cases later. So actually in that aspect, Kenya did very well. However, at the same time, as I said before, people become complacent. They are now tired of this disease. And now is the big risk, because now you actually get the surge of cases. People are traveling up country, people are moving around, people are not wearing the mask, people are not washing their hands. So it's now is the big risk that people, because of their complacency, are now exposing themselves to greater risk. So this is where we really have to be very careful now.
All right, and let me ask you these two questions in one. Are African countries overwhelmed? Most of them they're testing less because they're saying they do not have the reagents. They're not locally available. They have to get them elsewhere, not even talking about the cost of acquiring them. So are African countries overwhelmed? And two, what is the World Health Organization doing to help the countries that are really overwhelmed? Because I do understand your mandate is on public health here.
So in terms of being overwhelmed, so the lab kits are just one example. And let's be clear, this is not only a problem for Africa, really across the world. In countries such as the UK, there are not enough test kits. So this feeling of being overwhelmed, of not having enough kits, that is actually not a uniquely African thing. That is actually across the world, in South America, in Asia, everywhere people are saying we need more test kits. So I think that should be very clear. In terms of the preparedness for the hospitals and the health workers, I think this is part of the problem that Africa has with relatively weak health systems. And that's why His Excellency the President has called on the counties really to get those beds ready and get the staff ready so that we are better prepared and don't get overwhelmed. Unfortunately, we know that in all the countries that have really been seriously affected, there's some degree of being overwhelmed, that suddenly the hospitals are full, suddenly there are so many cases that you don't know how to really treat them. So we pray that that actually does not happen, but I think it is possible.
Yeah, and on hospitals being full, some countries have introduced the home-based care program for their patients, especially the ones with mild symptoms. Let's talk about its effectiveness. Have you, as a body, approved this, and is it being effective in dealing with COVID-19 patients?
I think so. So there are certain requirements that have to be met. So certainly, if a positive case is being kept at home, they must be able to isolate in that home. So we know that many of the maybe informal settlements, you won't have the ability to do that. But for those that actually can do that separation of the case from the rest of the family, that is a good idea if they're asymptomatic. Of course, if they become symptomatic, or if they become have shortness of breath or something like that, then they must go to hospital. At the end of the day, you don't want all the asymptomatic cases in the hospital. That would actually overwhelm the hospitals too quickly. So those asymptomatic cases should be kept in either at home or in some other care facility designated by the government so that they can be taken care of, so that the hospitals are truly kept for those people that need medical attention.
And let me take you back to the peak. Most countries, as you had said, especially the European countries, reached their peak, but again, after easing the restrictions, they experienced another wave. You know, African countries have gone ahead to ease some of their lockdown restrictions even before getting to their peak. Was this a good idea?
It's difficult to say. The President also indicated the very difficult balancing act that decision makers have to make between the economic and the social and the health aspects. From a public health perspective, it is really important that these lockdown restrictions are actually kept in place. So from our perspective, during a rising epidemic like we're seeing in Kenya, it actually is wise to actually restrict movement, to keep people not to move around too much. But I understand that there are other considerations as well, and ultimately it's for the governments to make those decisions. We know that these restrictions of travel and of movement have been very effective in other countries, really countries that have been severely affected, such as Italy. It has really been the lockdown and the restriction of movement that has really brought down the cases. And the too early easing of those lockdowns we've seen in other countries have caused the second wave to appear.
And you said it was a balance, and the head of state indicated during his statement that yes, we are easing these restrictions, but again, does not mean that the virus is not here with us. So what are some of the conditions that maybe could have been put as a public health officer as we ease restrictions, as we allow people now to move? Remember, Nairobi is the epicenter of Kenya. So as we allow people to move from Nairobi to the rural areas where the most vulnerable, especially the elderly, are, do you think, do you feel there are some conditions that the Minister of Health should have put in place to ensure as we ease restrictions, then this must be put in place to also protect those in rural areas?
So I think clearly the personal behavior is of utmost importance. So those restrictions or those directives that the Ministry of Health has provided in terms of personal behavior should completely be complied with by everybody traveling outside the country, outside the county, or indeed staying here. I would actually call on Kenyans that unless they truly have to travel, that they really remain where they are. So really essential travel only, where there's an absolute reason that you have to travel. Because it's that restriction of movement that is really important. You don't want to take people that potentially have the disease from Nairobi into a rural area where potentially they don't have the disease.
And there were some recommendations that the World Health Organization had laid bare for countries before they think easing their restrictions. What are they?
There are criteria that the World Health Organization has laid forward to the government. It is the ability to treat patients, to test patients, to contact trace patients. So these are important things that countries need to be able to do. I think the most important for Kenya, though, is that these restrictions should actually be eased only once the numbers are declining. So this is really important to acknowledge that in a rising epidemic such as we have in Kenya, it is really important that only the most critical travel takes place and everybody else actually remains where they are.
Mm-hmm. And Doc, let us now make us understand some of the how coronavirus has mutated, because some people have not been so kind with the UN body, especially before you had reported that the coronavirus was not airborne, but then later there were reports that it could be airborne. Is it from research, or what? Why are we seeing this change in regard to the behavior of this virus?
Well, clearly, as you say, this is a new virus. So none of us have known this virus for more than 7 months. So we are learning. Day by day, we're learning more. So I think the World Health Organization has issued a new guideline that talks about how the virus is spread. And we should be clear that almost all the spread still is droplet spread. So people that are coughing, sneezing, singing loudly, shouting loudly, that is the way that the droplets are actually produced. Mm-hmm. We should be very clear that that is still the very most important way how the disease gets spread. I think the change that has been indicated by the World Health Organization is that, especially in closed spaces and where people are packing together, that in that situation the virus can remain in the air, in circulation in the air, a bit longer, and that's why they talk about the aerosol spread. Mm-hmm. But both of them actually should be handled in the same way. For both aerosol and for droplet, the mask actually is very helpful. For both the aerosol and the droplet, social distancing is very important. So, in fact, that slight change in how we understand this disease to be doesn't change the way how we actually should behave, and that's most critical. So please, let's go back to those original statements of how do we act.
Mm-hmm. And let's revisit the spread and symptoms of coronavirus. Any update on the symptoms and also how it spreads? Maybe you can update, because most people think it's when you stay, you keep 1 meter distance, you put on your mask and you wear your hands, then you're safe. On the symptoms, most of people know that if you have a cough, you have fever, sneezing, then those are the symptoms of coronavirus. Yeah.
Indeed. So coughing and sneezing are the most important symptoms that almost all the patients develop. If they develop symptoms, as you point out earlier, many people actually remain asymptomatic or have very mild disease. So that's also something that we are learning. But those that develop symptoms, nearly all of them have got a fever and cough. Then some runny nose, sneezing, the loss of smell, the loss of taste. There are also some additional symptoms that we're starting to notice. So skin rashes, or children have got some specific diseases that they develop. But these are relatively minor, don't happen, relatively rare. So it is really the coughing and the fever that is most common in terms of the symptoms.
Yeah, and once again, who is at a risk of developing complications? At first, we had been told that those with underlying conditions and also the aged and the young babies because of immunity. But lately, the country has reported deaths of people who are not in that in those classes that I've mentioned. Who is at a risk of developing complications and also succumbing to this virus?
Well, the fact of the matter, actually very few children have died of this disease. Even here in Kenya, it's actually very few, a handful maybe. Comparison to older age groups, so 30, 40, and then above 60, actually, people that become ill with disease are much more at risk. And then people that have got pre-existing conditions, be it diabetes, be it heart disease or hypertension, but also obesity. Those are all preconditions that actually make this disease attack you in a greater way. So these people are more vulnerable, at a greater risk. That is not to say that a young person cannot succumb to this disease. We know that there are people that do die that are young again from this disease. It is not to say that young people will not get respiratory symptoms, but the likelihood is much smaller.
And because the virus, you say, it's in the droplets, when you sneeze, when you cough. So are asymptomatic patients able to spread this virus?
Absolutely. No, clearly it's the same mechanism. So if an asymptomatic person sneezes, those droplets can also transmit the virus.
I thought asymptomatic means this person is not sneezing or...
No, but everybody sneezes. It might be from hay fever or some other condition that you get a funny smell or something. It's true that the likelihood that you sneeze is much less, but even loud singing or loud speaking can produce those droplets, so it's not limited to sneezing.
All right, let's talk about the research going on. Most people here are asking how far are scientists with developing a vaccine for this. It's been more than 6 months, when most people thought after 6 months we'll have a vaccine for this, but now do we have any hope?
In terms of vaccines, you should realize that a vaccine normally takes years, 10 years to be produced. So that's the normal process of a vaccine. The fact that we're already talking about a vaccine after 6 or 7 months is quite extraordinary. It's quite unusual that we so rapidly have already got some candidate vaccines. And there are actually quite a number, 108 or so candidate vaccines that are coming online. They still have to be tested. It's very important that we know that they are safe and that they are efficacious, that they actually do what they're supposed to be doing, namely protecting people. But it's still going to take a while. So I think the current projections are that this year it is unlikely that we will have a vaccine this year. Perhaps early next year we'll have the first candidate vaccines that will come through the process. But then, of course, you have to produce them. You have to produce billions of doses so that you can cover the population of the world, and everybody that is susceptible can get them. So even once the vaccine is present, is shown to be effective, you still have to go through the production and the distribution cycles. So I think we should expect that maybe in the first half of 2021, that's when the vaccine will actually be able to get to the common people, to myself, to yourself.
And there's someone who is asking, before I ask you my next question, will this pandemic end?
Will it end? It will end. Sooner or later it will end. What I think is going to happen, though, is that this virus will stay with us for a very long time. Like we have used to have pandemics of flu, etc. Even afterwards, that virus is still present. It will no longer cause these huge outbreaks. But I think this huge outbreak that we have at the moment, it will end sooner or later. But it really is important that individual behaviors actually change for that. Afterwards, we will still have the virus. Here and there, you will have people that succumb to this disease even, but it will not be of this great nature that we have it now.
So as we wait for the vaccine, which you said it's unlikely going to be ready this year, how do we protect ourselves from getting the virus and even spreading the virus if we are infected?
So, I mean, on the one hand, there's the personal behavior, things that we've talked about. The issue currently is, of course, once you do have the virus and once you get sick, how can we best treat that person? So currently, unfortunately, there's no known treatment to this virus, but there are some medications that are showing some promise. So there's a medication that was linked to the Ebola virus that seems to be showing some promise. Some dexamethasone that the UK actually has promoted as a possibility. And these drugs are currently being taken into large-scale trials so that we can truly ascertain if they are helpful or not. Because, of course, drugs also have side effects. So we don't want to give drugs unnecessarily. If they don't really help with this disease, they shouldn't be given. But WHO is doing a huge trial across many countries to actually determine if these potential treatments are actually helpful. Then ultimately it's really important that there's oxygen. So increasingly we understand that this is a disease that oxygen actually is quite important. So the hospitals that are preparing for this disease actually are preparing also to have oxygen available, not only ventilators but just piped oxygen, so that people can get enough oxygen into their lungs.
And what are your projections as a body in terms of how this virus is going to affect? Because we as a country had projections from the ministry that our peak could be around August or September. But what is your projection as a body for both Africa and European countries on how this virus is going to affect these countries?
So I'm very hesitant to give projections in terms of number of cases. It is already clear that this virus has got a huge economic impact, and it actually is causing economic hardship and decline of countries' wealth already. I'm very hesitant to actually put any numbers to that, so I would not like to actually do any projections in that way. We've seen that some countries that have thought that they were past the disease are now getting second waves, and that's something we don't understand very well yet. So countries that actually already had a peak and had declining cases and now are starting to show additional cases. So exactly how that is happening and exactly how that actually will continue is still unclear.
And before we get a few questions from our viewers, let me ask you this quick one. How should COVID patients, especially those under the home-based care program, how should they be managed?
Well, they have to be isolated. That's the first thing. So they should be in a separate room, ideally with separate amenities if possible. So they should be separated from the rest of the family. They should wear a mask and wash their hands and completely be separated also in the linen and the washing and everything like that. They should have food served separately. They should not be eating with the family. So there's a complete separation of the person from the family. If possible, the people taking care of the case should wear proper masks, a surgical mask or N95 mask, and should wear gloves, and then follow the same procedures of hand washing and distancing from the case. It is also important to cover the face, because the droplets can also actually go into the eyes. So for people that are truly taking care of COVID patients, it's also important not only to have a mask, but also a face shield.
All right. And lastly, I would be asking you about as countries come up with recommendations, what's the WHO's recommendations for countries in terms of the capacity? How many hospitals, let's say, because the country, we already have at least a 300-bed capacity for every county. That is a requirement by the Ministry of Health here in Kenya. But from the World Health Organization, what is your requirement? I know it's a country's responsibility, but what do you advise countries to prepare themselves in terms of hospitals, isolation beds, and also the home care program that you're talking about?
So there are not any strict guidelines to this, but we know that countries such as Italy really had approximately 15% of all COVID cases, all positive cases. About 15% of those required hospital admission. So that's the first thing. And about 5% required ICU admission. Now, if you actually project that into the Kenyan population, we are far away from having enough hospital beds or indeed ICU beds in the country. So at the moment, I would encourage people not to start thinking, have we got enough, but really gear up much more quickly. And it's not only putting a bed there, but of course there's equipment, there's staff, there's amenities, all those things. And the Kenyan government and the Ministry of Health have really been working towards that with the counties to actually make sure that that happens, but we're far, far from where we should be.
Let's pick a few questions from Twitter. William Mwamburi is asking, where did this COVID-19 come from? Is it from a lab or from an animal?
It's ultimately not clear yet, but the most likely source is a animal virus that has been transmitted to humans. And we find that with many diseases that humans are actually facing. Ebola is like that, even a Zika virus, and ultimately a virus such as measles that we always think of as a human virus also has been transmitted originally from animals. So the greatest likelihood is that this is a virus that came from an animal, was transmitted to humans, somehow mutated so that it can transmit from one human to another, and now is causing this problem.
All right. And at Dora, a caller is asking, how would someone differentiate between a common cold and COVID-19 infection?
Well, the symptoms initially are actually quite similar. You would also have fever, you might have body aches, you might have the coughing and the sneezing. So in this current situation, if you have symptoms that look like flu, it is actually potentially true that you actually have COVID. So you can't distinguish just by looking at the symptoms. So in that case, it would be wise to actually have a test done to assure yourself.
All right. And again, there's a question coming in. If vaccine is not ready, what will happen by the end of the year and going forward, meaning we will live by wearing masks, observing social distance, and throughout?
Unfortunately, at the moment, that is the case. So up until the place where we have a good vaccine or indeed good treatment, the social distancing, the masks, the stopping of gatherings, the restriction of movement is the actual main tool that we have. So until these tools come online, until we've got them available to us, it unfortunately will mean that actually we will have to go through these kind of restrictions. We know that from other countries in Europe maybe, that once they've passed the peak, they've actually reduced the restrictions on movement. But if you pay attention, they are still wearing the masks, they are still maintaining the social distancing, even in countries where the cases have actually dropped away completely. So for the foreseeable time, I think we should expect that this will continue.
All right. And at Bokosa on Twitter is asking, suppose I am infected with the COVID-19 and being asymptomatic. One, am I able to transmit this virus? And then number two, is there a possibility that it will disappear by itself?
Firstly, yes, you can transmit if you are asymptomatic. Let's be very clear about that. So we've got many cases where actually an asymptomatic person infected other people. So that's a very, very clear yes on that one. Will the disease disappear by itself? Ultimately, people will become immune against the disease, and ultimately the disease will probably not disappear completely, but go down by itself. The big question is, if we don't follow our directives, it will actually cause such huge outbreaks that actually people will succumb to other parts of the other conditions, etc., and to the disease. So it is really important that we actually make sure that not too many people get ill at the same time, so that we can actually treat them properly. Ultimately, maybe in a year, 2, 3 years from now, I think this pandemic will have gone down completely again. There will still be a few cases, so going away completely to absolutely zero, that's unlikely. But I think the huge outbreaks will pass.
All right, let's pick two more. Jane Wambui is asking, there is a concern I'm having, especially on stigma. Why are COVID patients in African countries not willing to come out, while as compared to the European countries where they can freely talk about their status? Does it have anything to do with how the Ministry of Health is handling them and even the society?
I think that's a very important point that Jane makes, is the stigmatization is really hampering our effort to actually get control of this disease. Because if people fear that once they test positive, that other people, the people around them, or indeed the authorities will treat them differently, they will actually decline to be tested, or they will actually not want people to know that they are positive. And that in itself will make the disease become worse. So it is really important that everybody, the people that are positive and the people that are negative, and everybody understands that stigma is part of the problem. It actually accelerates the disease because it makes people fear to be tested and to be seeking treatment. So this is very, very critical that actually we get hold of this problem and really deal with it properly.
And there's another one tied to that one. Odor Joseph is asking, most of us, me included, don't believe there is coronavirus, especially in Africa. Is it our fault? Is it the ministries of health that have not sensitized their people enough, especially on the seriousness of this disease?
So I think it is a fact that this is a true virus. It has truly caused these diseases. You can look at the numbers, over 12 million cases, over 560,000 deaths. And in many countries we can actually see that there is disease that is over and above the regular disease. So it's not just another flu or just another disease. So just to counter his idea that this is not a real thing, it truly is a real thing. We can prove it is real. And the numbers actually show that there are many more deaths and disease than there were in previous years at this time. So it is really, really important. Has the ministry and governments informed the population? I think actually in Kenya that the ongoing information is well done. There's a lot of media attention, there's a lot of social media attention being put to this, and the information is going out. What I'm really concerned about is that there's a lot of fake news. There's a lot of information on social media that people spread indiscriminately, not understanding that this fake news is actually part of the problem and puts their neighbors and their friends and everybody at risk because people become complacent.
All right, and that would be all for now. I will welcome your parting shot as we wind up.
So thank you for this opportunity. I think the World Health Organization works together with the countries of Africa, specifically here in Kenya. And it is really, really important that we don't move backwards now. We actually need to be more stringent, more careful with the wearing of masks. It's more necessary to wash the hands, more important not to stigmatize people. So all these things that we've thought we've done this for 4 months, it's time to stop that. No, now is the time to restart it because in fact the cases are increasing dramatically.
All right, we are now ending our show at that point. Time for us to restart. Most people are talking about fatigue, wearing masks 4 months on, but Dr. Rudi Eggers is saying we should restart this because we are just getting started as a country and there is no hope, if I may say, of a vaccine, especially at least this year, but we hope it will come as we proceed and go on adhering to these guidelines on COVID-19 prevention. Dr. Rudi Eggers, thank you so much for your time. It's always great having you here with us, especially talking about some of these dilemma that people are having on this pandemic.
Thank you so much.
Thank you so much. Looking forward to having you again.
Thank you.
All right. And that's the end of our show tonight. Thank you so much for your time. Thank you for watching, for your feedback. Highly appreciated. I'm Purity Museo. Baron Abuli has been our sign language interpreter. Good night and God bless.